All right, we are live. So thank you all for joining us April 4th at 1:30. We're going to start the Greater Boroughs Partnership for Health. And there's no in-person attendance and there is no public comment. So for that, I will start a roll call for each town. So Boylston,
Sarah Barrett here, Boylston.
Southborough,
Chelsea Malinowski present.
Westboro.
And Sullivan here.
All right, and then Isabella Caruso, I, Northborough. So we see some new faces. So maybe quickly we can just do some introductions. Maria, do you want to go first?
Sure, absolutely. So I'm Maria Gonzalez. I am the health inspector for the town of Westboro.
And she's the other voting member for Westboro.
Lisa, do you want to go?
Hi, yes, Lisa Johnson. I'm on the Board of Health in Northborough.
Perfect. Sarah, do you want to quickly we'll go around.
Sure, Sarah Barrett. I'm on the Board of Health in Boylston.
Taylor?
Taylor West, Assistant Health Director and Public Health Nurse for the town of Southborough.
Chelsea?
Chelsea Malinowski, I'm the chair of the Board of Health in Southborough. Nice to meet you.
Heather?
Hi, Lisa. Heather Ucker, Health Director, Southborough.
All right, and Jen?
I am Jen Sullivan, Public Health Director, Westboro.
Perfect. Hi, Lisa. You know me. And Maria, it's so nice to see you again. All right. So this meeting is apart from our quarterly meetings, really to talk about the FY24 budget. So to start us off, can each town give me an update on their IMA process? And I guess I can start. So Westboro and Northborough have the same law firm or town council. So they're getting our IMA back to us by tomorrow. So that should it's moving in the right direction. Southborough, do you have an update?
So I think got delayed because of our town meeting. So I did check in with council maybe last Friday. So I'll ping him again.
Okay. All right. Perfect. And then Sarah, do you know anything about your IMA process with town council? You're on mute.
I don't have an update, but I will message town council as well here.
All right, perfect. So we'll just keep that ball rolling. We do need that new IMA in place before the end of the fiscal year, so June. All right, any questions about the IMA process? No? Okay. All right, so fiscal year 2024, I'm going to share my screen. So we have some money to spend. Let me just get this. Did everyone see that?
Yep.
All right. It's loading on mine. Okay. I just wanted to share this picture. This was actually at the Northborough Southborough High School yesterday for National Public Health Week, and they had so much fun sharing what public health means to them. But back to the budget. So right now we have approximately $118,000 left over that needs to be spent before the end of the fiscal year, which is June 30th. I had previously circulated the packet with allowable expenses, so hopefully you had some time to review that. These PHE funds do not roll over, so we really want to use them to, as much as possible before the end of June.
Sorry,
And
how
then
much did you say?
What was that?
I said, I'm sorry. How much did you say?
118.
Okay, thank you.
And then I do know FY25, the funds will be level funded. So we'll have the same amount for next year. And that budget and work plan process has not started yet at the state. It'll probably be May or June. So this is a busy slide, but it's a bunch of allowable expenses that were in that document that I just want us to talk through and decide what are our priorities moving forward. So there's obviously nursing supplies. These two charts are all the items that we can possibly order. So I did
Isabella.
Yep.
Sorry. I'm not sure if it's just me, but I'm still on the
Advance the slide.
Yeah, I am as well.
title slide.
Can you see it now?
Yes. Thank you.
Oh, that's
Yes.
weird. I'm like looking at a different screen. Okay. So let me show you this again. So $118,000, need to use it before the end of June 30th. And FY25 funds will be level funded. Sorry about that. All right, so these are the charts with all the nursing supplies and vaccine clinic and fairs. So these are all allowable expenses. We don't need to ask for any approvals. We can just go ahead and start spending that money. So I will ask anyone who has items that they see that they need to email them to me within the next 2 weeks. I'd like to do a big order to get that rolling. Jen, I know Jim had sent me a few ideas as well, including possibly a freezer or a portable vaccine cooler. So all of those
Both.
ideas are great. So just keep them coming. We definitely have money in the nursing supply line item to buy these things. The same thing goes for inspection supplies, fees or membership fees, training, all of that. And then a new allowable expense this year is the logoed apparel that we talked about last time. So that is approved for $250 per employee. So like public facing employee. Chelsea, do we need a vote on that to move forward with that?
I would, just so that if you're expending funds, just so that the towns agree.
Okay, so I think at least from my perspective, this would be a good use of money. It would be $250 per employee. And it would be able to have the Greater Boroughs logo and your town logo.
Oh, great. So I make a motion to move forward with the purchasing of logo apparel for each town, each public facing individual in each town.
Do you want to add nursing supplies too?
I mean, that's already in our budget.
Okay, cool.
So I'll second that. And I just have one question.
Mhm.
Isabella, how are you defining a public facing employee?
Yeah, so I talked to Kristen actually this morning. So unfortunately, it does have to be an employee. That's how it's written. So board members probably won't be able to fall into that category. I can ask again. But I would say any staff that we have, so shared staff or like admins that are talk to the public.
Okay.
Okay, all those in favor?
Aye.
Jen, I, Southborough,
Malinowski, aye.
Boylston.
Barrett, aye.
Okay, and Isabella, I, Northborough. All right, perfect. So we'll move forward with that. I think Taylor's going to take a lead on that. We have a meeting in a couple weeks to just pick out some designs or clothing pieces, and then we'll send out a sizing chart or sizing survey. Any other questions on these allowable expenses or any ideas that people have? And Jen,
For the training and credentialing, if we had something that we wanted on our side, how would we go about that, Isabella?
Yeah, so you mean paying wise?
Yeah.
So depending on the organization, so a lot of like, for example, so like if Penny went to a conference, she would just fill out the registration, send the invoice to Northborough, and we would send the check, or we could reimburse the individual if that works better.
So I guess are we okay with just putting those requests in? Like, is this group comfortable if a town had something that we're just going to go ahead and do it to expend the funds? Or do you want to say up to a certain dollar amount? That's what we're authorizing today. And then if it's above and beyond that, then we'll approve it. I just want to make sure that we have guardrails in place if needed, and that everybody's comfortable with using that for that expenditure.
Any thoughts on that?
I think it comes down to you and how you want to manage it. Like if you get close, like, I don't know, I don't want to overspend.
Yeah, I don't foresee that happening. I would just say keep sending me any requests. If I track the budget as, day to day. So as I see we are getting close to like some total line items, I can then send an email to the group. Any big ticket items we're obviously going to discuss here in the next slide.
I mean, I guess from the Southborough side, I'm very supportive of using this money for training and credentialing, no matter what town. I just want to make sure everybody else was kind of on the same page.
Perfect.
Okay.
And then Jim mentioned was it a freezer you guys were looking for? or fridge?
Yes.
Okay. Freezer.
Freezer and also the portable cooler.
Okay,
I think he's gonna be sending you all the specs this week.
perfect. Okay. Does anyone else need a fridge, freezer, or anything for vaccines?
We have
I
a
don't think
freezer.
Boyle,
We have
I'm
a
sorry,
we have a
Taylor.
freezer that we don't utilize, Jen.
Huh.
I
Is
don't
it a
know if
tiny one or is it a
it's
big
tiny.
one? That's
But
what we're
if
looking
Jim,
for, I think.
if Jim wants to come and look at it, I know we're trying to spend money, but I have never put a vaccine in it since I acquired it, so I got it for free from a pediatrician's office that was closing. So if he wants to look at it, he can swing by anytime. He can just text me.
All right, great. Thanks.
And then Sarah, did Boylston need any vaccine, fridge or freezer?
I don't think so, but when we're through, what I'll do is send an email to Anne Marie and just ask her if she can give some input because she's been great about handling this kind of stuff. So I don't think so, but I will get in touch with her.
Okay, and feel free, I think she was on the email chain, but just send her that allowable expense packet and I can send it after this meeting as well. The last page has these two charts as an attachment.
Okay, thank you.
All right. So can you see this next slide? Okay, perfect. So these are some one-time allowable expenses. So the state recognized that a lot of towns got their contract late, so they weren't able to expend all of their funds yet. So they did come up with some more creative ideas to hire a consultant. The first one we've talked about a little bit, which would be hiring a consultant to develop a strategic plan to use those opioid abatement settlement funds. So that would include soliciting input from those with lived or living experience, which is a requirement of using those funds. So I'm just going to skip to the next slide real quick, just because I knew there was some interest. We did have these three quotes before Kristen had left. So these are three different consultants that would be working on separate parts of the strategic plan. And the quotes right now are each consultant is under $10,000, which I'm going to double check with our finance director, but should be fine with procurement law. But I just wanted to talk a little bit more about this. So how have towns started to use these funds? Have you solicited input or feedback?
No, I was hoping that we would be moving forward with this.
Okay. Yep.
Same.
And then Sarah, any work with opioid settlement funds yet? I know Northborough, we have not.
No, we did talk about it. What meeting? February. And I missed the March meeting, so there's nothing new that I'm aware of, but again, I can send it out to the board and get some feedback.
All right, so people are generally interested in this, and I can send this out via email. But would we like to take a vote on this? So the most important thing is most of the work needs to be completed before the end of June, the end of the month. The end of June. So we really want to get this started if we're interested in it.
I make a motion to move forward with the opiate settlement strategic plan as written.
Second.
All in favor, Westboro?
Jen, yes.
Chelsea,
Okay.
yes.
Boylston?
Brett, yes.
All right, and Isabella Northborough, yes. So I will contact these three consultants and get back to you with some more information, but we will move forward and start planning. So this will include, as it kind of lays out here, some virtual presentations, some data collection focus groups, and then a real strategic plan to identify how to use these funds moving forward.
Isabella, have you talked to these three consultants about completing the work by the end of June?
I talked to Jen and Amanda. I have not yet talked to April.
Okay.
But I
And they
will.
think that this is reasonable to get it done in that amount of time?
Yeah, and the worst case, I did talk to the state. If they don't think they can finish the entire project, we could break it down into phases and really like the first and second phase be done by June
Okay.
30th and use most of the funds. And then if we did need to look forward into FY25, we could.
Great.
All right. So back to these other consultant options. So we still have some available funds if anyone's interested. So there's the digitization, there's some racial equity work, there's some social media website design, as well as developing a sustainability plan. So I'm not sure if anyone else has thought about what they're interested in or what they see for Greater Boroughs, but this is kind of the time to be creative.
So assuming that we expend the funds in the last slide that just voted on, and then any nursing and clothing equipment, how much money do you think you're left with?
So the nursing line item, we still have, I think like $2,000. So, unless everyone wants a fridge, and again, we have some wiggle room, especially with Erin, our full-time nurse's position, ending in October. We still have funds that really we do have some wiggle room. So I think we have enough if we wanted to do another bigger project. So I guess one idea I had, so Northborough did this resource guide, and it's a pretty big document, and I think Southborough is also working on a resource guide. It is a Northborough guide, however, most of the pages are like hotlines and resources in just either online or in our region, and we were thinking of possibly getting it translated in 3 to 5 languages, and that would align with our work plan as a health equity focus. So I wasn't sure if people would be interested in looking into that, and obviously all the pages would be available to everyone. And our library director said she would share the template for the entire resource guide on Canva, which is how we created it.
So your resource guide it's not strictly just for Northborough?
A couple pages are, like the first few, it's like the phone, the town directory and the public schools. But aside from that, it's really like mental health resources, substance prevention, LGBTQ, and it's all online. I can send it to you. We don't have to make a decision now. But just translating those pages, and that could be helpful to use for education and awareness in each community.
Taylor, can you speak to where we're at with the Southborough one?
We probably have 20 more pages to go through. But it's like when we have free time, we get to it. I will say, it's been a lot of work to update it to Southborough specific.
Okay. And do you guys have plans to translate that?
No.
Okay.
And how are we funding that? Sorry.
It's free.
Oh, it's free. Okay.
Yeah, because we're not printing it. That was proposed to select board and it was declined.
Yeah. Okay.
So I guess broader, we can think about if anything else needs to be translated. I'm willing to work with the library on this, so that's fine.
Just to let you know, I did look into this because I do think some sectors might be interested. It was roughly, I got from the school who does translation, that company, I think it was about $2,000 per language for your Northborough guide.
Okay, good to know. Does anyone else have any ideas or interest in, the digitization of records and data?
I think that's our best bet in spending the money is the digitization. I'm not really stuck on any of these. So if anyone wants, feels passionately about any of them, let me know. Or let us know. I'm really not. So, I mean, I think in order to spend the money, if we had to, the records would be the best way to go.
So I agree with you, Jen, that digitizing records is something that we're probably all lacking in. And we actually do scan our records electronically, and then we have the big files of all the big plans for when somebody wants to come in. So we actually are scanning them. One of the things that we don't have, and maybe some of you guys do, is a way for a resident or a contractor or anyone to actually get those files online through some sort of request or view on like you would for a deed or something else on the state website. So that's something that I would be interested in exploring, is how can we get those records accessible to the public if we're going to go the digitizing route. Because I think the less foot traffic we can have, like if it's just a simple, where's my septic on my property, and I don't have to go down to the Board of Health to have them print it for me, and I can actually access it myself online, would save our administrative staff a lot of time.
So since we're all on different phases on that, how would that work? Because I think that's a great idea, but I think it's getting us all on the same.
So I guess I don't know if the way that we're scanning is going to lead to an ability for us to do what I just described. So I think if we all agree that that's where we want to end up with that capability, then we kind of figure out what that program is, and then back into, okay, what would we need for digitizing, and maybe what Southborough's doing does work or it doesn't work, but then we at least spend the money on getting you guys digitized, right? And then phase 2 would be getting it online.
I think that's a great idea, actually.
Yeah, so I think it is a great idea. This is a one-time allowable expense. We haven't, they haven't let us know if FY25 this will be included.
So I guess,
Well,
I haven't done enough research on this, Jen,
Yeah.
to know like how much it's going to cost to do that. But at least I just don't want to digitize it and then be in 3 years be like, okay, and now we're going to do this program, and what we did for digitizing doesn't work, right? Like, so, and maybe that means that Southborough has, through phase 1, we have to switch how we're storing our records, and that's part of phase 1. And that's what we do for this year. And then if funds become available next year, or if, we can maybe apply to Greater Borough or the PHE for more funds just to kind of complete phase 2. I just want to make sure whatever we do, it's going to lead to the next step and where we want to end up.
Yeah. And
so
Boylston.
if this is all just, a one-time allowable expense, if we could maybe break it down to, scanning everything, and then this second phase, if South Boroughs is done correctly, and if not, let's make it correctly done, and then how much it would be to have public access.
Yeah.
So yeah, I agree with that. But I feel bad. I mean, if we're all behind you and yours is able to be public record at this point, and we're still having to just scan ours, how does that work?
I mean, so
It'd be great if we all are at the same level at one point, for sure. I just don't know how that would work. I mean, what would you get out of it?
We're all in this together, right? And I think we need to be at the same place so that we can get some efficiency. So I think if we're one step ahead, then let's get you guys caught up, and then it'll all even out in the end. I'm not overly concerned with it. I think it's for the greater good that we kind of make sure we're all using the same system, and that way we can gain some efficiencies there. So
I mean, hopefully we could be surprised and it can all be included and done. That'd be great.
maybe that would be nice.
Cross our fingers, right? That'd be really good.
So, and Taylor and I were talking the other day about this actually, and there are some towns that already have this, so maybe we can kind of dig into that and figure out how to get it done, and then loop back with you guys after we figure that out.
Great.
Sarah, what do you think?
Well, we're still in the process of digitizing, and running out of space in the Board of Health office, just filing cabinets upon filing cabinets. So, that's where we're at. We need help.
So Sarah, are you actually scanning?
I am not.
No,
Melanie
sorry.
was.
I
Yeah.
meant
I'm
you're-
not going near it. But Melanie, we do have the big scanner. Yes,
And
Melanie.
so so as you do things, you're scanning them into.
Oh, no, I
somewhere?
think she's doing it as she has the time.
Okay.
Yeah.
I have a question. I'm sure that's very time consuming. I know how time consuming it is in my little office at home for things I haven't scanned yet. So, to mitigate the expense, there's quite a few public health programs here in Massachusetts. Have you thought about maybe having an intern during, whenever period it works for you so that they could scan it for you and also have an opportunity to learn what you do and learn more about local public health?
Yeah, are you talking more like high school or college?
College, MPH level.
So we do have a college intern this summer. The only problem, like they need to complete a practicum, so I don't think scanning paperwork would kind of meet their practicum requirements.
It depends on the school and it does depend on the practicum requirements. I know that sometimes like some are more epidemiologically focused, others are not. So maybe, even just being able to observe, assist with some of the other activities that you could have an intern do and then do some scanning on the side. Maybe that's an undergrad type of thing too, but I'm just thinking it would be inexpensive and an opportunity for them to see local public health. But I know that also requires some effort on the individuals who have to have another body there and, get them trained and up and running, but just food for thought.
No, it's definitely a great idea. And I think even if we do hire someone, like we'll have to have some like upkeep. We'll have to know where the files are stored. So I guess this all sounds great. Again, my only concern is we have 2 months and it definitely will be over procurement. So we'll have to get bids and that process. But I can definitely get started if that's what the group is interested in.
I am interested.
Okay, let's vote on it now and then I can get back with more information.
So, I move to look into the hiring for digitizing legal legacy records and data and possibly, hopefully, make it public friendly and accessible.
Second.
All right, all those in favor, geez.
Jen, yes.
Chelsea, yes.
Sarah, yes.
All right, perfect. So I will hit the ground running with this so we can have as much time as possible. And so that is really, I think that would get us to our total. So I will stop sharing my screen. Does anyone have any questions about the budget?
Are we planning on touching base in May? I just want to make sure that if the digitizing doesn't pan out, that I'd like to be able to spend as much as we can. And so I think if we could meet in the middle of May, just on that one item.
Absolutely. Do you want to set up a meeting now or do you want me to email everyone?
I think we should do it now.
Okay.
I think we should do it now as well.
All right.
We're looking at Thursdays, right?
Yes, that seemed to work best for the group.
Or do May 2nd or May 9th?
Either works for me.
I'd prefer the second.
Second.
Yeah, I can do the second.
The second at 1:30.
Yeah.
Yeah, I can do that as well.
All right.
Perfect.
Perfect. Great. So I will send updates via email and then we will meet regarding the budget and then we have that June meeting to talk about the FY25 budget. All right. All right, so any other questions before we move on? All right, so I
No.
just wanted to talk a little bit about public health, or well, I think I'm gonna skip the budget planning unless people have really big ideas right now that we want to start thinking about, like staff. But I don't have any of the budget or work plan information for FY25 yet.
I'll just throw what I had out there. Isabella and I spoke about it a little bit. We have some hoarding issues big time in our areas. So if we could hire possibly a part-time person to just focus on that in our communities, that would be great. Something that, you know, we unfortunately don't have the time to do because you all know it takes forever to do. And also, we're looking at nursing because fortunately for us, we're lacking on nursing. And then another health inspector, part-time or quarter-time or something, just to do our re-inspections. Those are the ideas I had, just putting them out there so you all can think about.
I just have one general question, Isabella. When you say it's level funded, that does not account for any COLA increases.
I don't think so. So it's the 460.
So what are we doing about keeping it level service?
Level service, and what do you mean?
So you have the same amount of money year over year. So how
Yep.
are we increasing employees' pay? Or how are we accounting for
Yeah,
that?
we should, because Northborough, I mean, we're a town of Northborough employees, so we get that.
Right.
2%
So
COLA, 2%.
how are we going to account for that in the budget? I think we just need to talk about what that's going to take away from, because we're going to have to cover increases to the employees.
Yeah, I think we saw this year, I mean, when Kristen was the director, we put like $50,000 or $60,000 in a consultant line item with really no plan. So I do think we
Okay.
have some wiggle room.
Okay. I just want to make sure that we
Mhm.
cover the staff.
I can project it out for our next
Okay.
meeting too, but I don't, it won't be a problem.
All right. It clicked with me when you said level
Mhm.
funded. I was like, oh, wait a second.
Yeah.
Okay.
Any other
Also,
ideas? Go ahead, Jones.
Pool Code Pro. So I don't know if any of you have pools, semi-public or public pools, but we're wanting to add that to our software.
Love that idea.
Okay, cool. Any other software people are interested in? All right, perfect.
Are there any other options for software? I didn't know pools was an option.
Yeah,
Those
so
are
right
the
now
numbers.
it's just pool, food and housing.
Okay. Okay. No camps, huh?
Not yet, I know, I'm hoping soon.
Okay.
After today, oh my gosh,
Oh, I know.
talking about throwing a ton of information at us in 2 hours.
Yeah, Michael Seeger was asking us, he's already asked relevant, there isn't another kind of general inspection. That would be of interest to him if there was sort of a software that just was generally for inspection, like, because he does some, transfer station or, one-offs that aren't technically housing or food or pools, but there's not one for just general inspection.
Okay, I can get that quote for the pool and add it. Any other bigger ideas to start thinking about for FY25?
Nursing software.
Nursing software? Do you have any in mind, or you'd have to do some research?
I would look into it. I'd get you some concrete ideas.
All right. Perfect. Well, we'll obviously meet in May, and then we have that meeting in June that we will fine tune this budget once I have more information about the work plan and the requirements of the grant. So very quickly, public health nursing. So Jen kind of mentioned it. So Jim is moving to Westboro for 12 hours. So we will be rehiring our full-time nursing position, who was Erin. She left at the end of October. So she technically was a Salmon contract. We are now going to hire the full-time nurse as a Northborough employee for the greater boroughs. But we do plan on keeping the salmon contract, which is Penny, Celeste, and then any other per diem like clinics for the next couple years through the contact tracing grant. So I just wanted to make sure we were all on the same page with nursing staff.
I had no idea. I thought they were gonna let the salmon VNA contract expire. That's what I was told last.
No, so I mean, we wouldn't be able to hire all the town of Northborough staff, and we do have Penny for 24 hours and Celeste for 6, and we could add another part-time if people were interested. The full-time position under Northborough is just like the, first step to kind of go away from contracts, but it's a slow process.
Okay.
All right, any questions about nursing? All right, and then last year we did buy 12 adult mannequins for CPR and 12 infant mannequins. So we are starting to do some CPR classes. So Taylor is trained and ready, right, Taylor? And then we do have Heather Welch, who is also a salmon VNA nurse, who's been helping us with some Narcan, and we'll be starting with CPR trainings. The only thing with that is we need to collect some funds for the American Heart Association card. So I know with Northborough and Southborough, what we typically do is we put the class registration through the rec department because they are allowed to take in funds. Do you know, Jen or Sarah, if there's something similar in your towns?
Yeah, definitely. I could touch base with our rec director.
Okay, perfect.
I don't think we have anything, but I can follow up as well.
Okay, because I'm pretty sure the card, so obviously the staff time would be covered by the grant. Heather, and especially the new nurse that we hire, and Penny's also interested in getting trained in CPR. It's just those cards are $30.
Is it first aid and CPR, or is it just CPR?
CPR AED. Right, Taylor? Sorry. Okay.
And how much are you thinking the fee is going to be?
$30.
Thank you.
Any questions about that? We had one in Northborough on Tuesday, and we had 9 people register, and they had a great time. Mary Ellen from the school and Taylor did that for us for Public Health Week. Any other questions? All right, so we did move this meeting to Thursdays at 1:30. So we have that meeting we just made, and then June 13th, September 12th, and December 12th.
Thank you. This works out so much better for me.
I'm so
Really,
glad.
me too.
I was a little confused. I was like, wait, today's Thursday, but it's perfect. All right, any questions or any other discussion to come before the board?
No.
All right. Well,
Thank you
I
as always. Nice seeing everyone.
yeah. Does someone want to?
Yep. I move to adjourn our meeting at 2:10.
Second.
I'm sorry. Yeah, of course, I got a phone call in the middle of that. Are we adjourning?
Yes.
Yes.
Okay.
So
Did someone
Jen,
second?
aye.
Sarah Brett, aye.
Chelsea, I.
Bella, aye. All right. Thank you all so
Thank
much.
you.
Thank
I will
you.
send an email follow-up, but I will see you in a month.
Perfect.
All right.
Bye-bye.
Bye.